Health and Wellness presentation on conjunctivitis by Pegah Rasti, Krista Henschel, Mary Rose Littlewood, Allison Houle, and Courtney Desjardins. Conjunctivitis occurs when the layer that surrounds and protects your eyeball becomes inflamed. Signs and symptoms include
redness, increased amount of tears, crusts around the eyes, especially after waking up, green or white discharge that's noticeable from the eye, itchy or burning eyes, blurred vision, or increased sensitivity to light.
Conjunctivitis transmission routes. Irritants cause pink eye, including
a bacterial or viral infection, a reaction to things such as contact lenses or eye drops, an allergic reaction to something such as pollen or grass, and a rare chemical exposure.
Ottawa Public Health regulations and requirements.
Wash all children's hands often. It's a good idea to watch children after doctor has prescribed medication to ensure the child is overcoming infection. Child should not attend school early learning centers for 24 hours. After 24 hours with bacterial conjunctivitis, child can return to the daycare under circumstances that medication has been given and is given at the correct time to heal the infection. In cases of viral pink eye, the parents or caregiver of the child will be called, and the child will not be allowed back into the center until the infection has been cleared.
How can we prevent conjunctivitis in our early learning environment?
Ensure all tears and discharge is wiped from the child immediately with a clean cloth and ensure that the cloth is cleaned before next use, or disposed of if disposable. Ensure that blankets, pillows, and stuffed toys are cleaned often. Discourage children from touching their face and eyes. Make sure children and educators are washing hands often. If the infection is spotted, encourage parents to go to the family physician.
What the Early Learning Center will do in the case of conjunctivitis.
If it's bacterial pink eye, the Early Learning Center will firstly call parents, and child will not be permitted to attend the child care center until they have been on antibiotics for 24 hours. If it's viral pink eye, parents of the child will be called, and the child will not be allowed to attend the Early Learning Center until infection is gone. The Early Learning Center will also send a letter home to all parents with children at the center to inform them of the conjunctivitis that has been seen in the center.
What the parent or caregiver can do when the infection is present.
It is the responsibility of the parent or caregiver to see their family physician to determine a diagnosis. If it is bacterial, the child can be prescribed antibiotics. If it is viral, you must wait until the infection clears on its own. Clean child's eyes with a wet cloth and do not reuse. Ensure child takes prescribed medication.